I just want to tell you about NADONA. NADONA is such a passion of mine, and we just love our membership. We want to make sure that they're successful in their roles as DONs and nurse leaders, and it just brings such a wealth of satisfaction to us as our membership survives like the pandemic and has grown even through that. And so thank you so much for allowing us to share who we are. So the question is on the slide, who is NADONA? Well, since 1986, we have been the leading advocate and educational organization for nurse leaders in the post-acute care continuum. We were founded by a group of dedicated post-acute care professionals. You know, it's 3 decades later, and we still have our board of directors made up of post-acute care professionals. People want to be on our board. They see the value in this organization. We exist solely for our membership. Today, with thousands of nurse professionals strong, we really still remain committed to understanding the daily challenges that those nurse leaders go through and making sure that we have the resources that they need for their professional success. Our mission statement says that we want to be the leading professional organization for current and aspiring nurse leaders through professional development, board certification, and clinical expertise related to the promotion of health and wellness of individuals in both long-term care and post-acute care continuum. You know, we really live our core values. They include integrity, professional advancement, interprofessional collaboration, exceptional customer service, diversity, and inclusion. We live that on a daily basis. Our whole intent is to make sure that we're providing the best service that we possibly can to our membership through these values. Our objectives then are having a global environment where the individual's health and wellness goals are met by having a diverse healthcare professionals committed to clinical excellence, making sure that the population health management is good, leadership and advocacy in the specialty of long-term care through board certifications, professional development, and the advancement of evidence-based practice. That's so critical that we base our practice on that. Well, what's our membership like? Our membership is made up of DONs, ADONs, infection preventionists, staff development, assisted living nurses, LPNs. Any nurse professional can join our organization. And if anybody has any questions about that, please contact me. I'd love to talk to you about it. We have a new committee started that's called the Infection Preventionist Committee, and it's actually a subdivision of NADONA where we're actually providing infection preventionists with lots of up-to-date resources and ongoing news and information. So that's another area that you can join within NADONA. You know, over our 37 years or so of existence, we've held 36 annual national conferences, with our next one coming up the end of June. We put out a quarterly journal called The Director. We have a successful scholarship program. We've awarded over $500,000 in scholarships since we started. We've created 8 certifications with over 5,500 nurse leaders and healthcare colleagues certified to date. We have a highly acclaimed nurse mentorship program. As I said, we're here for our members. An active professional corporate leadership council who gets together and actually helps lead where we go in regards to what's going on out in the world. A highly sought after Nurse Leader of the Year award, and we recognize that person at our annual conference. And we put together just so many educational resources available through webinar and Zoom trainings and our toolkits. So we have all of these certifications. I won't read them to you, but for everything except the diabetes, we have pre-exam trainings through Zoom, through webinars that you can take online at your own leisure. We have a new one. The last one is our quality assurance and process improvement, and that one is coming out in July, late July. And for all of these, you get you can take a certification exam. However, if you wish not to take the exam, the course is still very relevant and provides you with information that you may need. You know, our director, Sherry Dorenberger, has this saying, and she says, no one understands all that you go through in one day. No one knows the details, the obstacles, and never-ending challenges that are a part of your job as a nurse leader. No one, that is, except NADONA. Because at NADONA, we've lived what you're going through. We know what the trials are. So we're somebody that you can call, somebody that you can lean on, and we'll be here for you. Thank you.